Hey everyone, Kylie Moss from the Centers for Vulvovaginal Disorders. I wanted to check in with you because there was a patient we saw this week that made me really happy, and I also think illustrated some of the complexities we see when we deal with patients who have vulvovaginal disorders. And I got permission from her to share her story, so I just wanted to share it with you. We saw a patient who'd had a baby a couple months before she first came to us, and she also had a history of lichen sclerosis, and she came in complaining of a lot of vulvovaginal pain as well as discharge. And my first thought, having not examined her yet, was, oh, this may be related to lactation because she was breastfeeding. And sometimes when you're breastfeeding, you can get really significant changes related to the low estrogen state that happens when you're breastfeeding. It can be a lot like menopausal syndrome. And actually, Dr. Rachel Rubin and Dr. Jill Krapf and a couple of other people presented an abstract at Ishwish a couple months ago about Geniturinary Syndrome of Lactation, using that as a term. And I love that term because it really is what happens. It's very akin to the menopausal state in lactating moms. And so I thought, or, people who are lactating. So I thought I should really, do a good exam, but probably she needs some topical estrogen. We'll see what's going on. And when I looked, she had, symptoms and findings that did not seem classic for purely changes related to breastfeeding or lactating. And she had a adherent discharge that was sort of greenish. She had a lot of ulcerative changes to her vulva that were way beyond what I would expect in someone with poorly controlled lichen sclerosis or changes related to lactation alone. So I talked to her about starting a little bit of topical estrogen. We talked about eventually getting her back in pelvic floor physical therapy. She used it before, and anytime you have a flare in your vulvovaginal symptoms, that can make your pelvic floor muscles become more tightened. So the pelvic floor physical therapy part of it is really important for improving things. But first we had to make her skin feel better. So we started her back on a good regimen for her lichen sclerosis. It started her on topical estrogen, and then we got cultures. And this is where the part of the story that was a little bit of a plot twist, because it turns out she had something called group A strep. And that's the same kind of strep you can get when you have strep throat. So instead of having strep throat, she had strep vulvovaginitis, and she really needed special antibiotics that we would not have picked up on if we had just done one of the newer probe tests for vaginitis that test only for Gardnerella or yeast, which are the classic causes of vaginitis. So I think I'm just glad that we test more broadly for vaginitis causes, because every once in a while we do see someone with a bad group A strep infection in the vagina, and that can be really uncomfortable and take different antibiotics than you would pick up on if you were doing a PCR test, which is where you probe for a specific microbe like yeast or bacteria, particularly Candida or Gardnerella are the classics that are detected on those tests. So anyway, we saw her back a month later. She was doing so much better after the antibiotic course. She was back on a good regimen for her lichen sclerosis. Her skin was looking much better. And she's going to use a little bit of topical estrogen to help with some of the lactational changes that can probably help her have more comfortable intercourse going forward. And she's back in pelvic floor physical therapy. And overall, I think she was just a really great success story who, a month before looked like she was in really bad shape, and everything improved quite a bit over the course of a month. So there are lots of layers to vulvovaginal disorders. I like this story because I think it highlights both the number of things that can be happening and the fact that you can get better. So just a good story to hopefully give you some hope to start your weekend and some optimism about the future of vulvovaginal disease treatment. Hope you're having a great day and a great weekend, and I'll talk to you soon.